Because January was Cervical Cancer Awareness Month, as an OBGYN, I am like the queen of one of the most effective cancer screening tests, the Pap smear. So obviously, I had to do a video on cervical cancer. Cervical cancer is strongly associated with human papillomavirus, more commonly known as HPV. So let's talk Pap smears. Pap smears, the screening test for cervical cancer, start at the age of 21. The actual test itself has never been one of the top 3 favorite things women like having done. It's like, who would you rather, the dentist or the gynecologist? A Pap smear is performed by visualizing the cervix, which is at the top of the vagina. This visualization is obtained by inserting and opening a speculum inside the vagina. Speculums are not one size fits all, so no worries. We will find one that suits your vagina just fine. The cervix looks like a donut, i.e., a circle with a hole in it. The cervix represents the lower aspect of the uterus. A sidle brush, spatula, cervical broom, or any combination of the aforementioned are used to obtain a sampling of cells from the inside and surface of the cervix. These cells are in turn sent to the lab for evaluation. How often you get Pap smears is a conversation that should be had between you and your OBGYN. In women under 30, as long as there are no previous abnormalities, a Pap smear can be done every 3 years. In women between the ages of 30 and 65, either Pap with no HPV testing can be done every 3 years, or a Pap smear with HPV co-testing can be done every 5 years. Having said this, regardless of how often you decide to get your Pap smear, you should see your OBGYN annually. Let's talk HPV. We can't talk about cervical cancer and Pap smears without mentioning HPV. Human papillomavirus is a sexually transmitted infection. It is very common. About 80% of the sexually active population has been infected with HPV at some point in their lifetime. It's very common. About 80% of the sexually active population has been infected with HPV at some point in their lifetime. To make the life of a gynecologist easier, we divide HPV into 2 groups, low risk and high risk. Low risk HPV types are associated with things such as genital warts. High risk HPV types, specifically types 16, 18, and 45, have a higher association with cervical cancer. In most, HPV is a virus that can be cleared on its own. Specifically, in healthy individuals, most HPV infections are asymptomatic and will resolve without issue. HPV can be associated with cancers of the vulva, vagina, penis, anus, mouth, and throat. Therefore, safe sex practices are highly encouraged. Barrier contraception, as well as having an open conversation with new partners about their sexual history, practices, etc., will help decrease acquisition and passage. Cervical cancer. Cervical cancer occurs when the cells that typically make up the cervix become abnormal. This abnormality typically manifests as cells dividing much more rapidly than usual, invading deeper tissue layers, and eventually either spreading to other organs or forming a mass or tumor. It typically takes several years for cervical cancer to develop, which is why screening tests such as Pap smears that can detect early cell changes are important. Risk factors for cervical cancer include early age of forced intercourse, like earlier than 18 years of age, having multiple sexual partners, having sexual partners with a high risk profile, high risk as defined by types of sexual activity and or the number of sexual partners. Other risk factors include smoking, personal history of vulvar, cervical, or vaginal dysplasia, family history of cervical cancer, and a history of sexually transmitted infections. Remember, HPV is an STI, sexually transmitted infection, and where there is one, there are bound to be others, i.e. chlamydia, gonorrhea, the list goes on and on. Initial signs of cervical cancer can include things like abnormal bleeding, spotting, or watery discharge from the vagina. Bleeding or spotting may occur after sex. Pelvic pain, issues with urination, swelling of the lower extremities can be signs of advanced disease. Once cervical cancer is diagnosed, it is confirmed via colposcopy. The colposcopy will provide a biopsy for confirmatory purposes. Once confirmed, cervical cancer will need to be staged to determine the extent of invasion and spread to neighboring organs. As a generalist, once I diagnose cervical cancer, I refer to a specialist for further management and treatment. That specialist is a GYN oncologist. Treatment options for cervical cancer range from hysterectomy to radiation therapy to chemotherapy, depending on the stage of your cervical cancer. For further information on cervical cancer, make sure that you check out the blog post at askdrangela.com. Thank you.